Hello, this is Alan from World Acupuncture. I'm just answering a question from practitioner Vicky, who's posted on our forum a very challenging case history. This case history is about a 76-year-old female patient who recently, or 10 months ago, had half of her thyroid removed as a result of growths on the thyroid. And a month after that surgery, she developed polymyalgia. Her symptoms include very painful and weak muscles, and the arm muscles are so weak that she needs the other hand to help her lift the arm. The hands are beginning to shake now, and there's extreme stiffness in the body, especially first thing in the morning. She feels the pain on the large intestine, triple warmer and small intestine meridians on the arms, and the bladder meridian on her legs, especially behind the knees. Her arms, legs and abdomen look very swollen with pitting edema. She also contracted pneumonia 2 months ago and is still coughing. Until recently the mucus was non-productive but is now yellow. Any movement of her body makes her cough. When she had fever from pneumonia, all her muscle pain went but came back. There is a weakness and pain around conception vessel or REN 4, REN 12, left side stomach 21, and right side liver 14, on the right ribs, and gallbladder 25 and 26 are very painful. All of her pulses are weak, but more so the kidney and spleen pulse. She is overweight in her abdomen and has broken capillaries on her nose, cheeks and legs. Her digestion is okay, but she has had a tendency towards diarrhea in the past. She appears to be a cold yang deficient type of individual. Thanks for the question, Vicky. A very challenging case history and a tricky one as well, because there's a lot going on. I would be suspicious in the first instance that perhaps this patient's pulse is extremely sunken as a result of lack of fluids actually traveling within the blood vessels, and apparently just looking at this, the fluids are actually extraneous and taking up occupation in the subcutaneous tissue. It's a very tricky condition for sure. In everything I say, there is a possibility this patient is indeed spleen, well, I would say spleen deficient, but quite a strong possibility of spleen yang deficiency. However, as a result of the fact that she has extreme pain in the right side liver 14, gallbladder 25 and 26 area, I would be very suspicious of a pathological condition of the liver. We would know it as a liver excess condition. This may translate as blood stagnation, or what we call liver excess fever syndrome, or the sequela of liver excess fever syndrome, where the fluids have been withdrawn or evaporated and become extraneous to the blood vessels. I would recommend for this patient, particularly in light of the fact that her upper limbs are so weak and that she's experiencing what we would probably describe as, what I would describe as the deficient heat style of pain in the yang meridians in the arms, I would suggest a spleen deficiency root treatment as the fundamental deficiency, utilizing the metal point of the pericardium and spleen meridian at pericardium 5 and spleen 5. I would palpate again around the right side upper hypochondrium area, around the 11th and 12th ribs. If that is very painful, then we would have to deduce that in fact there was a liver excess condition prevalent. With the lung pathology being such a dominant excess condition, I would be inclined, if that were the case, if there were pain and discomfort in that upper right hypochondrium, to shunt the point, the metal point of the liver meridian, liver 4. I would also pay very close attention to the lung meridian, and in this case I think strong measures are needed to help her to recover from the pneumonia. And I would suggest, if in fact that there is a lung excess condition, that the shunting of the point or the shear cleft point of the lung meridian, lung 6, would be appropriate. At this stage, I'd be a little reluctant to do much dispersion on the yang meridians on the arms until we had built up the spleen meridian sufficiently to make that dispersion relevant or appropriate. And we have to be careful in this particular situation not to get too carried away with the symptoms and the clearing of the symptoms, but to really initially to approach that fundamental deficiency. If we get that part of the diagnosis correct, then any work that we might do to remove deficient heat or excess heat from the meridians will be far more effective. I would also be looking at utilising the back shoot points, bladder 13, perhaps bladder 43, certainly be looking for the diaphragm, bladder 17, bladder 18, the liver, bladder 20, the spleen, bladder 23, the kidney, and definitely bladder 40, the lower Ho-Si point of the bladder meridian, perhaps in conjunction with the point, the low point perhaps of bladder 58. To understand that whilst there is an indication of kidney pathology here, that we really need to build the spleen energy up to support the kidney at this particular time and to help and ameliorate the dysfunction of the liver meridian and liver organ complex, and therefore rectify some of the excess that's apparent in her lung organ. This excess in the lung organ would be contributing hugely to the deficient heat that's accumulating in her upper body and making that area so dysfunctional. I think I will leave it at that now, Vicky. I would recommend that you do check and palpate the right side of the hypochondrium, come back to the forum, let us know what your findings are specifically there around that right side, and if in fact there is quite a deal of pain and discomfort, I would strongly recommend that you would approach this condition as a spleen deficiency liver excess condition. I look forward to your reply, and thank you very much for your question. And to those who viewed this video, thank you for your interest and your commitment. Cheers.